Welcome to the CNA eMD documentation course. This is Module 1 and will include 3 modules that will cover documentation to the following flow sheets: the vital signs record, the intake and output record, and the assessment and intervention flow sheet. After you successfully log into eMD, you will need to access your patient's flow sheet for documentation. You will do this by choosing your patient from your current list and single-clicking on their name. You will navigate to the Flow Sheets tab and single-click on this tab. You will then find all the flow sheets that have been loaded for this patient by looking on the left-hand side under Flow Sheet Selection in your Options panel. You can narrow your view by different chart selections, by the date range, and then you will navigate through each flow sheet by clicking on the appropriate flow sheet you want to document to. Before you begin documenting, you must add a time column to document to. To do this, you will access the flow sheet you want to document, right-click up in the gray box at the top of the flow sheet, and choose Add Single Time Column. This means that you want to document now. You will adjust the date and time if necessary, although we do promote real-time documentation, and you should be documenting at the patient's bedside. Once you add your time column, you will see that there is a date and time. You will right-click in this field and choose Edit Text. You must enter CNA in this blank box and choose OK. This will label your time column so that all can see who is documenting for this patient. We will start documentation with a vital sign record flow sheet. After you've added your time column successfully, you will notice that we'll start with the temperature. There are a series of hashtags or number signs in the field by left-clicking next to the field you want to document to. There is a decimal point, so you will enter the temperature with a decimal point. When we choose oral, that is our site, and it is a single click. Moving down into blood pressure, you will enter the non-invasive blood pressure and choose the correct source. So what arm, leg, and so forth. Our respiratory rate is also a numeric value, and our heart rate. If you scroll down, you'll be able to see that you will enter the heart rate, numerical value, and then the method. Was it a device or auscultation? Please don't document to heart sounds. That is a nursing assessment. If you scroll a little bit farther to the bottom of this flow sheet, you will see an area to document height and weight. This is where you will record your daily weights for your patient. We document only in kilograms, and all scales should be set to record in kilograms. You will then go ahead and obtain the scale that was used to weigh your patient. You will notice that all your documentation is italicized. You must save the documentation on the right-hand side in order for your documentation to be valid and saved. Please continue to Module 2